Hi, Kate. It's really lovely to have you here. This is a podcast episode for Unschooling members, which is called Tea and Guest, after sort of tea and chat, sort of a more exclusive form of that. And it's really lovely to have you along. I have known Kate probably for a couple of years. You started off, I remember you popped up on like some webinars and things, particularly things that me and Naomi have done. You can correct me if I'm wrong. And Kate also, as it would happen, helps admin the Live, Play, Learn community on Discord. I'm hoping she's still there doing that. I haven't heard otherwise.
Yeah, sometimes.
And we had the pleasure of actually meeting last year, 2023, at the what conference was it?
Rethinking Education.
Thank you, Rethinking Education conference. And that is really, I guess, I don't know if I'd asked you before then, or whether I really thought it would be a really good fit to invite you to come along and talk on the podcast about your specialism, which is speech and language. So you introduce yourself, Kate, and tell us a little bit more about your speech and language role.
Okay, so Kate, I am a speech and language therapist. I practiced for 17 years for an NHS trust, mainly working in clinics. And that was so preschoolers up to the end of primary or sort of junior age. My particular specialism was working with children with a stammer, and that expanded to include teens and adults who stammer, as well as children who are selectively mute or situationally mute. So that sort of side of things. But I also, had experience of assessing children as they come in, as they get referred to our service, which could be for all sorts of reasons. So at the moment, I'm not working because I have stopped so that I can home educate one of my children. So I've got two children. One is 10 and she is now unschooling at home with me. My eldest is 13 and still in school, choosing to stay at high school with her friends. So we have a foot in both worlds, which is an interesting experience.
Yeah, maybe we can talk about that one day as well. Initially, I'd sort of thought we would, talk specifically about the stammer aspect and the situational mutism, because those are things that actually I see and hear coming up quite a lot, that parents talk about in unschooling communities. But I thought that might be sort of skipping a step really. So we're gonna have a chat today about speech and language in general. And I'm gonna ask you to give your expertise on those things, but from an unschooling perspective.
I'll try.
You're not going to try, you're going to do it, and you're going to be very good at it. I know you are. So maybe we could just start a little bit with like what is speech and language therapy, and what is the role of a speech and language therapist?
Yeah. So I mean, we talk about speech and language, and to put it bluntly, language is having the words to communicate your thoughts. Speech is the sounds that you use to make those words. So we might have someone who's got the words or who understands their words but isn't saying them clearly, so we're worried about their speech. But we also could have someone who just isn't learning words the way that we would expect. So they might not be using words verbally to express their thoughts and their needs, or they might not even understand the words when they're hearing them. So that's where our title comes from. But to be honest, we're more communication therapists, because we are not just about verbal communication. It's not just about being able to speak in sentences, and lots of people think we're doing elocution or something, and we really don't. That's not what we're here for. Our role is to make sure that everyone has an ability to communicate, and they're given access to communicate to the best of that ability. So for most therapists, it would involve working with children, sort of young children, as they develop, to see, are they picking up language? Are they picking up their first language? Whatever that is, it might be English, it might be something else. But are they picking up their first language as you would expect children to normally do that? Most children will do that. If they aren't going to be learning the words as we would expect, how can we help them communicate? Because we need to give them a voice. We need to enable them to get their thoughts across, to get their needs across, and to be able to connect with others in some way. So that's really what, it's that broader idea of communication as a whole. So.
Yeah, that's brilliant, and it's nice to remember that it's about communication and not just about like what the words that are being formed or heard and how they're being interpreted, that it's actually bringing people together, particularly giving children tools that they need to be able to communicate, whether that's with their voice or not. But you did you've brought up the thing that I think is the key question for unschooling families, which is about, if we suspect that our children maybe do need some support, or you use the word normal, aren't the same as their peers. There's so much in unschooling that talks about, our children aren't behind when they're learning, and some of our children do learn to read, significantly later than their schooled peers. And obviously in school as well, you have, I'm going to say professionals, but you have other adults around you who are also in communication with your child and sort of maybe picking up whether they need extra support or not. So the question I'm leading to really is, at what point for a parent with an unschooled child would you say they need to maybe consider like a self-referral? Because they don't have those extra adults around to sort of have that input. Like what would you say were the things that would...
And you brought up the idea of, school, obviously they have these expectations, and let's be honest, the very role of speech and language therapy is to check developmental norms, and we're trained to have those in mind when we're with children, so that we can spot, well, hang on, this is not normal.
That was in air quotes for anyone that's listening and not and not watching.
that word that doesn't really mean much. So all of our assessments, they're standardized. You've got that bell curve of the lump of children in the middle who are doing their average things, and then you've got the outliers either end, and you'll always have that variation. And we're looking at, right, okay, so who do we need to help along? And obviously when we're thinking about unschooling, we're kind of, well, does that matter? They're going to get there at some point. They might take a different route, especially if they are neurodivergent. Their communication is going to look different. So yeah, when an unschooling family comes into contact with a service like ours, there is that whole, well, we're looking at this and wanting someone to fit this pathway, and you're not, you're letting the child lead the pathway. So that sort of contradiction, that imbalance is going to be there.
There is a clash, isn't there? Because and we quite often see it in unschooling, particularly when we maybe seek services or expertise out of the unschooling world, that particularly for children, it's predominantly about how can we make this child fit into school, and that's maybe not our motive. our motive might be, how can I help my child improve their communication?
Yeah.
And which is different to how can we make this help this child communicate in school, because the environment's different and the situation's different. There's well, as unschoolers know, they're like worlds apart. But it's like the aim of the therapy or the intervention or the support is different, so that, like you say, it is. Have we answered the question about when, as an unschooler, you might? No, we didn't. Backtrack a little bit.
Yeah.
Are there any things that you would say this would be something I would seek advice about?
Which I haven't included, I didn't mention that we do. Speech and language therapists work with swallowing, safe swallowing. So if a child is eating and drinking and they're coughing when they're eating and drinking, that is definitely a reason to ask for a referral to see a speech and language therapist, especially if they're getting lots of chest infections. So whatever developmental path the child is following, and whether you're unschooling or not, if you've got a concern about their eating and drinking and their safety, definitely seek a referral for speech and language therapist. And that's something that unschooling parents might not be aware of if they're not, they're not.
And I wouldn't automatically think that of referring or suggesting a speech and language. You probably would go to the GP and hopefully they would be the ones that would recognise that that's the service you needed. But that isn't something that I would automatically link to speech and language.
No, it's not. But because of the anatomy, we end up being the profession. I won't say I do it because that's not my lane at all. But yeah, therapists will check out the safety of the swallow so they can help if there are health issues coming from that. So that is a definite one to seek a referral for. In terms of the actual speech and language itself, if a child is unable to, if they can't follow instruction at all, if you, as a parent, you're getting frustrated because you're trying to explain things to your child and they just are in the world of their own and they can't understand, or they're just looking at you like, what's going on? I don't know what you mean. Then that would be a reason to refer, to get help, to see how can I connect with this child? How can we come up with a way to communicate? If the child can't express their ideas, their thoughts, so they're getting frustrated, getting really upset, or if there's just no means of communicating between you and they just go through their life and they can't get your attention, they can't ask for anything, then definitely I think that's a time to get a referral. And hopefully the therapist is not going to be suddenly pushing your child down this path of they need to do this, they need to do that. What the therapist will do is to have a look at your child and say, okay, this is where they are, this is their attention, this is their type of communication, their type of interest. What can we put in place to bridge them with their carer, with their parent or whoever it is that they need, their primary carer? How can we, whether it's pictures, whether it's gestures and signs, it might be using a switch or something that will provide words or phrases for them, but is there a way to bridge that gap, or to in some way make that connection between the carer and the child, because we don't want the child to be frustrated and getting upset. Same if they are verbal, if they are saying lots of things but their speech isn't clear enough. It might be that parents can understand, but a visiting auntie who doesn't know them very well doesn't understand. That might not be much of a concern. But if the parent doesn't understand, or if again the child's getting really frustrated because lots of the sounds are just coming out wrong, and what they want, they know what they want, but it's just not coming out clearly, then again that would be reason to refer, to see, all right, okay, what can we do? How can we, does this child need more exercises, some sort of support to work on those muscles, to work on that coordination, They might get there later on in a different way, but if they're too frustrated and too held back for too long, that's going to affect their self-esteem. It's going to affect what they
it's interesting that it's
well.
all sort of it's not just about speaking or communicating,
No.
it affects other things.
Absolutely.
It affects relationships, and it affects your self-esteem, and those sort of things. And you've mentioned several times, you sort of keep coming back to, is the child frustrated? And is this, how is it affecting your relationship with your child as the primary carer? And if those things are sort of in place and strong, then if you've got good communication with your child, then this might be okay for now. But actually, if it's frustrating and it's not working, you aren't able to communicate, then those are
and is it getting in the way of their relationships with their friends? How do they interact with others? It might be that they're not ready to interact with others and they're kind of a little bit in the world of their own, or it might be that they really want to talk to their friends and their friends just give up because they don't understand them, or the child doesn't understand back when they hear something. So
it's really centering the child rather than really centering, which we do a lot in unschooling, but which is why I'm sort of bringing it back to that, because it's not really centering the communication or the speech. It's how is this affecting the child?
Can they do the things that they want to be able to do? So I guess with the school environment, it would be the pressure is, can they understand this part of the curriculum? Have they got this vocabulary? Can they explain to the teacher and use the right phonics? The more important bit, which does affect unschooling as well, is can they communicate with their significant adult? Can they build relationships with their friends and their wider community? Can they understand enough to be learning? Or are they watching videos and it's kind of all just passing them by because really it's word soup and none of it really means anything? So for
now, on that note, I wonder, well, I do know you have a story. I wonder, because this is close to my heart, if you have any stories or experience of maybe working, because traditionally, obviously, I trained as a teacher and you as a speech and language therapist. We talk about early intervention, and which I don't really want to encourage, but it's just like predominantly these services are full of younger children and aimed at younger children, getting in there early. However, some of us in the world have children who have a high need for autonomy, and maybe aren't ready to engage with people they don't know in places they don't know about, or have somebody tell them how to improve, or what exercises to do regularly, or what games to play, even if they dress it up beautifully. They might not even get through the door. Actually, you might not even get because of their need for autonomy. And I guess I wonder if you could share with us what happens or what is possible if these things are maybe addressed when the child is ready and when they say, I need help, or I'm ready to do that now and explore that now.
So as you say, all of the services are just pushed for the preschoolers. And actually, if you're thinking about NHS and if you're thinking about when to refer and whether to refer, it is worth checking what the criteria are, because some services will only accept referrals. Lots of the NHS referrals have a cut-off age. So it's really important to know what your local service is before you make a decision on whether to wait or not, unless you're happy to go private later on. But certainly, particularly in terms of speech, I think with language, the risk of missing out on things younger is quite high if you haven't quite got the language skills. But in terms of the speech sounds and working on those, when you're trying to work on something with someone, like you say, who's just not interested and not there, I can work on, I've known so many children who are like 6 or 7, and we try to work on a s sound to get that hissy s, and they're doing a kind of sound, and it is so hard. It's hard to explain. They don't care. They don't want to change. And so that's something I've always been, oh, do I have to work on this one with this child? A while back, I was referred a 13 or 14-year-old who was completely outside the criteria, but because she was having trouble with her speech, she was being picked on at high school. There was a big worry about her mental health, so they said, okay, bring her in. And we did, I think I booked her in for about 4 sessions. We did 2. The first session, I said, can you copy this sound? She could copy it. And then I explained what that sound was and where it was, and we did a few exercises, and within 2 or 3 weeks it was fine. She was using this throughout her speech in all sort of word positions as though she'd always had a good sound. And that's compared with 6-year-olds where I could be doing it for months and months, and they would be driven absolutely bonkers by it, and their parents would be frustrated doing the exercise, and then they would not get it. But because
it's interesting as well, though, because that is one of the sounds that one of my children, I noticed when they were sort of 4, 5, 6, that they really weren't able to go at all. Which was also doubly unfortunate because they had an S in their name. So it was noticeable quite a lot, not just in regular speech, but it felt like that would have a big impact because it was part of his name as well, and his personal identity. And we did and ah about, because as a teacher, I knew that would be something that would be referred, and we did and ah about it, and we decided ultimately not to, because of all the reasons we said. He could communicate. In fact, he could communicate with everyone. Everyone knew what he was saying. It was just that was difficult. He wasn't frustrated by it. Because of the lovely unschooling community we were in, variation was normal. It wasn't, it wasn't picked on. It wasn't seen as something to be ridiculed. It just was what it was. The only thing I did was I went and wrote down a list of all the people that I knew as adults who had sort of lisps and difficulty with their S's, including famous people, just so that I could go, look, they're fine. It's not essential that you have this one, that you correct this one thing. And also for us, it felt a little bit because it wasn't bothering him, and because it wasn't having an impact on his life, his communication, his friendships, and all of that. It did also have this element that actually it was me, maybe, that was then saying, this is you've got a problem, and I didn't want to do that when it wasn't. But now he's much older, and it's fine. So my story is, it's sort of, it corrected itself, or he learned it himself. As well, so it's
absolutely, and this is the scene I saw. She just needed someone to point her in the right direction of how to do it, and she could do the rest herself. That was fine. She wanted it to change, so she changed it.
Which sort of brings us back round to, there's that active involvement from the child, that they have to be invested in.
Absolutely.
One
point I'll come back to about, if you're worried, if you think you should refer or not, and you're wondering if as a parent you are feeling anxious and really worried about something, I think it is always worth speaking to someone, whether you do that as a referral or just to find someone to talk it through with. If you know a therapist you can get hold of, because the anxiety that parents feel can impact the child as well, even if the child's not frustrated, if the child's not upset. If you as the parent are, then it's still worth following up. And it might just be that you could get a couple of tips on, so if they want help with it, what would I do? Because when it comes to speech sounds and where to put the different bits of the mouth, we don't think about it usually. So a therapist could help and say, yeah, if they want to know how to do it, you can show them this. Or it might be something that isn't going to resolve quickly, but you're so worried about it, you just want to talk it through. And again, you could be referred and talk to a therapist, and just it might help to put your mind at rest. And anything that takes anxiety away has got to be a good thing, really.
What sort of things would you look for, or what sort of things should parents look for in terms of a sort of maybe child-centered approach to therapy? I think you've touched on a few of them already, really, but like,
Yeah.
what would you consider a sort of like a, like we're saying from an unschooling perspective, like a good match, a child-centered approach when our children are
Obviously, I would say just to keep in mind that a therapist will be looking at a developmental perspective. They will talk in terms of, sort of normal development, and if your child is, sort of delayed or a slightly disordered development. So just to be prepared for those sorts of words, it will come up. That will be, but if they're child-centered, then hopefully it would be more focused on what your concerns are and why you're there and what your worries are. And most therapists will be child-centered. It will be like, so what's the impact on this child? What's going on for them? And ultimately, that's what we like to work on and to focus on, rather than the numbers and the figures and we need to get this child to this level, because that's actually quite a soulless task. But the whole, this child is struggling to talk to their friends because they get so anxious they can't say something, so how can we help them? That is what we want to be looking at and working on. So you want to be having those sorts of conversations with the therapist. They want to have them interested in that. When it comes to neurodivergent children, of which there are quite a few unschooling, there are some friendlier approaches, and I think increasingly speech and language therapists are looking to sort of educate themselves better and to be more neurodivergent friendly. However, it's not the norm necessarily. There are still interventions which I would say would grate quite significantly if you're unschooling and child-centered. So if they start talking about social skills training or social skills groups,
deep breaths, people.
That is what a lot of clinics might offer. There's also, and again, it's informed by that whole school ready idea. Lots of therapy is done at a table. It's done getting the child to sit down. Again, hopefully the therapist would have lots of toys. They'd start on the floor and, follow the child's lead. But if you find that the therapist is being a bit more forceful than you like, or setting lots of boundaries, or using a more behavioral approach that you're not comfortable with, I think, those are flags to think about. Is this the therapist we want? Is this therapy what we want? Do we need to go elsewhere? Could we speak with the service manager to see if there's someone else who would be more child-centered? Can you speak to the therapist? And lots of therapists will be open to hearing, okay, this isn't working for you. How can we, or it's not working for your child. No therapist wants the child to be distressed when they're in their clinic. So they do work with the child and normally follow the child's lead. And quite often, more so than other people will do. So normally that's okay, but there's still a lot of behavioral approaches. It's about stickers and rewards. It's about good sitting, good listening. And I think it's not necessarily neurodivergent friendly. It's not an unschooling friendly approach to expect those sort of, right, they've got to sit and listen.
Yeah, especially for children. I mean, we've got sort of this dual thing going on. A lot of unschooling families do have neurodivergent children, but but also those who don't, the children aren't familiar with that approach, like come and sit at a desk and do this with me. It's just not especially if they're younger, it's just not something they're going to be familiar with. And we do live in a society where behaviorism is it's the standard approach. People very rarely can see an alternative, or have ever even come across an alternative without labeling it as wild and crazy.
So keeping an eye on, is it child-centered? Is the child able to consent to be in that activity? If the therapist is doing a fun activity and your child is happy to join in and you're happy with what they're working on, then fine. But if your child is clearly not happy, but they're kind of being coerced or pushed, if you're feeling like you're being expected to make them comply with something that really you're not on board with, then absolutely, I think you need to have that conversation about this isn't really working for us. And
it's trying to have a conversation whereby you sort of agreeing on the aim and agreeing on how to get there. So that you're working on the same, singing from the same hymn sheet. Awesome. I think we're going to leave it there, and I am going to invite you back to talk specifically about your specialist because that makes sense. About in stammering and situational mutism, which I do have experience of, not for myself, but in my family, and I know others have talked about as well. But I'm really grateful that you just sort of gave us that stepping stone into speech and language for now, and then we'll get back together for another half an hour at a later date. Is there anything that you feel you really must say and impart?
I'm sure that there is, but mainly just keep the child in the front of your mind and make sure what they need and what you need from whatever appointment you're going to, and make sure that anyone coming on board to work with them has that same thing in mind or similar things.
I'm going to ask, are you thinking of going back into because people are going to ask, they're suddenly going to go, speech and language therapist who understands unschooling? Yes. Because I've had emails this week. I've had 2 this week that have asked me for, do I know of an OT? Do I know of an educational psychologist? Do I know of a speech and language therapist who understand unschooling? It's something I'm asked all the time, and it's like gold dust when you're an old schooler, finding a professional who is, got that understanding already.
I would really love to
not yet
go back into practice this year, hopefully, but we're still early days in settling in, and I'm still very much needed most of the time.
And that's fine. That's wonderful. Just wanted to ask the question before anybody emailed me and says, I need Kate, tell me where she works.
I'm not available.
Not available, but you are available to listen here, and you're going to give us another session so people can hang out for that. Thank you, Kate. Thank you so much for coming and talking through that with us.